Welcome everyone. We are happy to meet you again in our next webinar session by OVOGENE Egg Bank. And you know already that this is our great tradition to meet almost every month together with you and share with you our achievements and results. Also our newest and exclusive strategies and algorithms. OVOGENE Egg Donor Bank is a reliable partner for IVF clinics and intended parents worldwide. Today we are going to talk about artificial intelligence as a unique feature of OVOGENE Egg Bank for oocyte morphological selection. The webinar will be presented by our scientific advisor and laboratory manager, Birol Aydin, who will share his experience in using artificial intelligence for oocyte morphology donor selection. We all agree that we should categorize and select best quality embryos in order to achieve the best results. So at OVOGENE Egg Bank, we believe that we also should do so for oocyte donor morphological selection. And we work hard to develop the criteria for the best quality donor oocytes, which you are receiving for your clinics and for your patients worldwide. And you know that this is our strategy to develop together and to become your reliable partners and to bring the highest quality materials and results. So this is a win-win situation for us and for all our partners. OVOGENE Egg Bank is an international bank supplying top quality frozen donor oocytes, also sperm and embryos to fertility clinics and patients. We arrange transportation of all also at OVOGENE Egg Donor Bank. As well as at OVOGENE Egg Donor Bank, we also have transparent guarantees and comprehensive. Can I continue or stop? Because I hear myself twice now. Yeah. At OVOGENE Egg Donor Bank, we have transparent guarantees and compensation packages. It is very easy to perform online donor selection and work with the personal coordinator who will support you or your patient during the whole process. We offer embryological laboratory support for every partner clinics as we perform protocols and video for thawing and also training and support constant 24/7. As well, we provide safe hand carry biomaterial transportation to all the locations where it is possible right now, considering the COVID terms. And if it is not possible, we perform cargo transportation, however, also by controlling all the conditions during away. You can see the world map marked with green, these are locations where our partner clinics are located right now, and patients can be referred to those clinics, and also clinics may start cooperation with us if they are still not our partners. We learn all details about legal sites and the screening regimes for each geographical location and every medical law which is currently valid in those countries, and we strictly follow all the regulations and needs of this country. So for our processes, we implemented ISO 9001 as a quality management system, and we strictly control every process starting from oocyte donor recruitment, screening, stimulation, exclusion and inclusion criteria, medical supervision during the whole process, laboratory conditions, storage, marking of donor materials, packaging, and transportation. For donor screening, we use only certified ISO 15189 medical laboratories. We have a software where we control number of donations per each donor and strictly control family limit per country. Also, for donor screening, we perform PCR testing of a day of the OPU for the donor. And if it is requested by the medical laws of the country, oocyte quarantine, and then repeated the viral infection diseases after the quarantine period. During that term, materials are stored in the quarantine tank. We perform comprehensive screening according to the regulations of the country and separate catalogs per country if anything additionally is needed, like quarantine or FDA testing or some psychological evaluations, etc. And direct shipping, mainly hand carry, as we mentioned already before. All our donors are young women aged between 18 to 29, perfectly physically and mentally healthy, knowing all their responsibilities for being a donor, fully screened with proven fertility and with no hereditary illnesses and negative phenotypical signs. You can see the list of the tests, including also genetic tests. And it is important to mention that we are storing the DNA for all our donors. And for part of our donors, we perform extended genetic testing, as well as the genetic report, including the 3-generation pedigree, is available for every donor. In order to become our partner and order donor materials, we need to meet, and online it is very easy right now, but also we are happy to welcome you into our facilities in Ukraine to check by your eyes and meet in person. After learning on all terms and conditions, we are signing the agreement. If it is needed by the regulations, local regulations, we will apply for the import license. And here the whole team, including quality manager, international coordinators per country, lawyer, medical and embryological team is working together to get the import license and the service level agreement be ready. After it is available, we will select the donor. You will select the donor through your personal coordinator and online database. Conduct the payment, perform the delivery of the materials into your clinical facility, perform sewing according to our regulations and recommendations with our full embryological support, and send us sewing results because we are tracking efficiency for every donor, and it is very important for us to get a feedback from you. So this is how we work, and we are happy to become your reliable partners if we are not yet. And we will continue going into our next presentation by Birol Aydin, our scientific advisor and laboratory manager, talking about artificial intelligence for oocyte donor morphological selection as a unique offer by OVOGENE Egg Bank. Please, Birol.
Just, I need screen share. Okay.
And dear colleagues, I haven't mentioned in the beginning of our webinar that you can type your question in any time in our YouTube chat, and we will be happy to answer all of those questions after we will finish our presentations. Thank you. And please, Birol.
Good evening, everyone. Once again, we meet one OVOGENE webinar session, and I'm glad to be here with you again. So till now, with the different webinars, we talk mostly about cryopreservation protocol, freezing, thawing, how we select oocyte morphologically, how we store oocytes, how we make witnessing and traceability. Now we are going more deeply as a scientific level. So how we do morphological selection by the biometric way and artificial intelligence. So actually, on the presentation, we will have a topic of three main parts. First, we will talk about oocyte morphological selection criteria. We will go part by part to find out the different part of donor oocytes, how we select them as a criteria. And the second part, we will talk about artificial intelligence algorithm. I will try to explain how we built the system, software, and how Microscope and Timelapse system is working with oocyte selection, because this is a unique product. Till now, you find out information about embryo selection, blastocyst selection, but we built, actually proud to say, after 2 years of long scientific research and work, finally we adapted the system 100% for the oocyte selection. And last part of the presentation, we will talk about benefits of artificial intelligence in egg banking. So firstly, let's go about oocyte parameters for the evaluation of donor oocyte quality. So of course, we are working with artificial intelligence, but what is the criteria of artificial intelligence using for algorithm? So firstly, cumulus oocyte complex morphology, thickness of zona pellucida, diameter of perivitellin space, first polar body appearance and morphology, shape of oocyte and diameter, meiotic spindle location and visualization, granulated cytoplasm or non-granulated, centrally located granular area we are measuring, and a time-lapse activity of the oocytes. So what does mean a time-lapse activity? We are able from now to provide all of our customers actually live video, image, and a vitrification, full process of video. So they will be totally sure about their vitrification process. They will find out even how we load their straw. They will see, like in the focus of the camera, how they are oocyte looking as well on the straw together with the quality. So if you talk about cumulus oocyte complex morphology, as you know, basically publications shows no correlation between cumulus complex morphology between fertilization and blastocyst rate and clinical pregnancy. But in egg banking situation a bit different. There are different images, as you see, but all of them has a different cumulus complex morphology. Some of them is so easy to clean during denudation by hyaluronidase enzyme, but some of them really thick tissue, and it's really difficult to clean them. So that's why, for example, image B, as you see, the cumulus complex is so thick. So while if you go directly for the hyaluronidase enzyme, if you are using 135 or 40 diameter pipettes, so you may give a damage to shape of oocytes, or you can just enlarge a perivitellin space diameter. As you know, when you collect the oocytes, especially if there are blood clots around cumulus complex cells, they may affect central granulation, and they can increase the central granulation as well. Second thing, such cumulus complex can make a kind of pathologic effect, especially it can stick the cryostraw. And when you try to clean out, when you try to thaw oocytes, so they can just make it degenerate your oocyte. That's why cumulus complex morphology is really important for egg banking. While you have to know which oocytes before denudation, you have to cut zona, and which oocyte you have to go directly for the enzyme denudation process. If we talk about the perivitellin space, so basically there are direct correlation between perivitellin space and fertilization rate. So if you see, when you have absent perivitellin space, the main problem, you will have very low survival rate. Still, we are using high percentage of cryoprotectant. And basically, when cryoprotectant enter inside of oocyte, before expanding the oocytes, should find the exact way to get a concentration. But when you don't have perivitellin space, it's just directly going inside of cytoplasm. And when you try to thaw oocytes, most of you find out that is easily. In the TS solution, oocytes start to get a bigger and it start to get a degenerate because a very high cryoprotectant concentration inside of cytoplasm. And when you try to thaw with a different molarity of the washing solution, it gets directly damaged. Large perivitellin space always give low fertilization rate, and high cryoprotectant concentration is directly making here a damage. Also, perivitellin space diameter, we are measuring here by the algorithm of artificial intelligence. So we have exact criteria on the artificial intelligence, the reference value. When oocyte inside, not inside of this reference value, we are avoiding those oocytes for the cryobanking. We are putting just directly quality to category. And we are using only for fresh cycle. So polar body morphology has a direct correlation between fertilization rate, clinical pregnancy, and a blastocyst rate. When you have smooth polar body, you will be able to get a better result, especially when you have freezing and thawing cycle for the donor egg. Most of the time, like, you can find out polar body disappear. There are two reasons why polar body disappear after thawing. Of course, every egg bank using only mature oocyte with a polar body, but after thawing, sometimes disappear. One of the main reasons, if polar body is a giant or fragmented or duplicated, so there is possible with high concentration of the protectant, they can get just degenerate. That's why after warming, you may not find out. So what is the effect of that? Firstly, main effect is the cleavage arrest. So for those kind of oocyte, you may find the cleavage arrest. And the second things, if you have exactly large polar body, that correlated with low blastocyst rate. And if you have a smooth polar body, doesn't matter if you have a large perivitellin space or thick zona, but a smooth polar body always give advantage to oocyte to get better fertilization rate and a cleavage rate. So this is the one of the important thing, polarized granulation. So, but basically it's not so easy to find out under microscope. As you see, first group of image looking fine. Even the second group of image, there are only some black dots which you can see as a granulation, but sometimes really difficult to analyze. Actually, there are not direct effects between such granulation and fertilization rate and embryo development rate, but it's still effect for survival rate. So for that, we are using artificial intelligence algorithm, but of course, artificial intelligence needs some kind of equipment to measure this granularity. So that's why we are using liquid crystal analyzer. So it's just a kind of laser. It's going deeply inside of cytoplasm and is measuring just amount of as percentage amount of granulation. So that give us advantage to know which oocyte is really in a risk group after warming. Let's talk about the thickness of zona pellucida, because zona pellucida also very important, not just for embryo development, also for the implantation. When you find out thick zona pellucida, so one of the biggest risks, like cryoprotectant concentration will not be exactly fine inside of oocytes. So this is the first risk. Second risk, during fertilization, after warming, if you don't wait an optimum time for the ICSI, you may give damage and your oocyte can get degenerated. When you find out thin zona pellucida, that will be very low zona birefringence. So this is risk for the fertilization because your ixipipette easily will go inside of cytoplasm. And when you come out, you will see like pipette just sticking inside of cytoplasm. And when you come out, cytoplasm will come together with zona pellucida. So that is the one of the risk as well. But what we are doing here for the artificial intelligence, I will try to show the for next slide. So basically, thickness of zona pellucida should be between 15 to 20 micrometer. When it is out of this range, always risk, not for just survival rate, but risk for the fertilization. So that is the explanation, one of the real explanation why it's happening after good warming. When you do fertilization during ICSI, you get degeneration from the oocytes. So oocyte looks fine, just you make fertilization, but it's degenerated. So this is the one of the reason because of birefringence of the zona pellucida. How you can avoid this? Anyway, I understand, of course, every lab doesn't have such high technology to use a piezo or something, but I can strongly suggest for the warming cycle to use non-spike of ixipippettes. So non-spike of ixipippettes will make a kind of piezo effect. Even if you have low zona birefringence, it will go smoothly inside of cytoplasm. And when you come out with pipette, it will not be sticky. So because level of, as an angle of the pipette is a different than regular ixipipette. You don't need to change microscope setup. You can use a same regular ICSI setup, but if you use non-spike ixipipette, you will get a better outcome always. So this is how we are implemented to artificial intelligence for zona birefringence. So for that, we are using basic meiotic spindle determination software, but software is connected also to artificial intelligence database. When we measure about zona birefringence, we find out, of course, for each oocyte a different criteria. Again, we have kind of reference. If zona pellucida thickness inside of this reference, we are going to freeze. But if not, we are avoiding from the egg banking and is going again to fresh cycle. As you see on the result, so when you use high zona birefringence, always you have better pregnancy rate and implantation rate. One of the reason, of course, because of the cryoprotectant concentration, and a second reason, because low possibility to give damage during ICSI process. Let's talk about artificial intelligence algorithm, how it's working. We have two sources for the main machine, because this is a machine learning. How much we teach the machine, that much information we will get from the machine. So one side, all information will come through morphological specification of oocyte, and another side, all donor clinical information will be collected by main computer. So from morphological specification, diameter of the oocyte, shape of the oocyte, darkness of the olemma, thickness of zona pellucida, diameter of perivitelline space, vacuole or smooth endoplasmic reticulum, polar body diameter and morphology, cytoplasmic granulation and maturation level, meiotic spindle appearance, meiotic spindle size and location, and zona pellucida birefringence. From the clinical part of donor, age and body mass index of the egg donor, previous cycle efficiency, which is very important. It will show directly how many mature egg we get in previous cycle, how many of them fertilized, how was the survival rate if we load the system, how was the blastocyst rate, and stimulation protocol, which stimulation protocol we used, and height and weight of the egg donor. When you put the oocyte under dynamic time-lapse camera or the time-lapse incubator, there will be two segmentation. One will measure will focus directly morphology of the oocyte as a cytoplasmic part, and the second will be focused on just the zona pellucida and meiotic spindle. So we will get here two kind of extraction and classification. We will get an algorithm from different source. All data will be collected by main computer. will start to make a mathematical calculation by, there are a lot of different measurements. All these measurements will keep in a one side. And from another side, all efficiency report will come. When I explain all of this, you may think, how long should take that? Because all this information, maybe in a 5 minutes, what you are doing, you are keeping your site out. No, it's not like this. That all information for each oocyte, 10, 15 seconds, already collected by main computer and analyzed. So this is the how we implemented to Microscope, because most of the artificial intelligence system is working by image base. So you are putting embryo in the Timelapse Incubator. Timelapse Incubator create a high resolution of the image and video, and then software, artificial intelligence software, just try to analyze and give different possibility. Our system is totally different. Our system is working with dynamic time-lapse camera, but this time-lapse camera implemented to Microscope. So while you are working under laminar flow, while you are working in X microscope, if you have meiotic spindle software, we are just implemented. So all information is coming from the different source. Doesn't matter how many embryologists working in how many working place, because each of them has this dynamic camera and all information collected in the main computer. So this is how it look like in laminar flow cabinet. So the dynamic camera just connected to stereo microscope and software already active in the background. So when you start to work in the process, software start to calculate automatically. When you stabilize the picture, you just take the image and you continue your work, and calculation in the background is continued. So there are, as you see, many square grid here. So even if you have here 50 oocytes, each grid will catch one oocyte and will make calculation individually. So on the end, when you finish the denudation process, you just take an image and you wait in 10 seconds, and all calculation will transfer to main computer. So this is the criteria which we load, like a reference value for the diameter, like diameter of ooplasma, diameter of the polar body, perivitellin space, appearance of olema, and a different, and a background, just the system starting to make exactly calculation and find out different damage in the part of oocytes. Also showing us where there is a possible damage on the oocytes. Let's say vacuola or smooth endoplasmic reticulum or high perivitellin space, system with giving us with the different colors. So we are find out, yeah, this is a big damage, because sometimes it's really difficult to see under microscope all of this. While time is short, you have to hurry up to freeze, because like if you are working in egg bank, you are not doing only one function per day. Like I'm talking 20, 30 functions sometimes. So there are big number of oocytes. You have to be quick, and at the same time, you have to be strict for the morphology. But just regular microscope to do all of this, actually from the human side, impossible. So how we connect the system to meiotic spindle determination? And then firstly, like a regular image is coming from the oocytes. And for these oocytes, our target to get exactly location of the meiotic spindle, but from the background, also tools are measuring a different part of the oocytes, as a polar body, perivitellin space, a diameter, inner diameter, outer diameter, and also in the next slide I will show like how zona configuration. As you see that here there are zona birefringes, because it gives red alert. Zona birefringes is a very low. So this is the potential oocyte, which most probably after warming during XC you will get degeneration. So still spindle is perfect, polar body is smooth, perivitellin space a little bit large here, but as you see, zona pellucida birefringe is very low. So this is a potential oocyte, which even if you thaw perfectly, you may have a problem during fertilization if you don't use some spike pipette or piezo. So you may get a degeneration. This is another oocyte. As you see, there are problem on the zona pellucida thickness. Problem is the morphology of the shape of the oocytes and very large perivitellin space. And of course, it's not considering a diameter very high, is not in the criteria, is not considering for the egg banking. So this is another image, also different calculations for the different part of oocytes. Still spindle visualization are perfect, but shape of oocyte are not good. Around a lot of cumulus cells, which actually in a fresh cycle perfect. I always believe to leave a bit cumulus cells around and as to use them as a growth factor, but still for egg banking it's dangerous for vitrification, while mostly when you leave more amount of the cumulus around of the oocytes, so it will be very sticky if you minimize the media on the straw. So when you thaw the oocytes, they may get very sticky to straw. So that how artificial intelligence will give the final value, how we will know, so which oocyte is ready to freeze. So as you know, like when you make embryo, artificial intelligence is giving you the percentage of implantation chance. So it's saying, okay, this embryo has a 79% of chance for implantation, or another embryo only 40%, another embryo 90%. So that you understand which embryo you will give priority for embryo transfer. So here we have a similar. So our main number is 1. So when it closer to come to 1, so that means that those oocytes has a perfect potential for the vitrification and high outcome. So when you find out on the picture, you will see 0.8. So that means that oocyte has a potential. So when it passes up to 0.5 possibility, that means we are calling approximately 60%. So we are considering to freeze. But when it gets less than 0.5, which I can say, like I will show in the future slides, when we as embryologists, when we say it is a good oocytes, sometimes artificial intelligence say, no, this is less than 0.4, and that we are not going to freeze. Let's talk about advantage of the artificial intelligence on egg banking. So an important application of for the selection of viable oocytes might be the optimization of cryopreservation strategy. And the main things, if you have problem, especially for legal permit for the embryo selection in your country, so that's the perfect chance you will have the best embryo selection criteria, because already you will find out high potential of oocytes. So that's why you may use such potential of the oocyte to achieve high quality of embryo. So another advantage, the system described different digital formats and image, which you will find out when you receive your oocytes. You will be sure about the quality. You will be sure about how we freeze, and you will be sure about how they are taking a place in a straw. Because sometimes it's happening, I will be honest. So you load the straw to oocytes, and okay, the next clinic who is warming the oocytes may say, no, there was one oocyte. So it's possible. Yeah, I understand that, because everyone has a different experience. When you go directly inside of TS solution, sometimes, yeah, concentration is very high and just oocyte flying out, sticking near the wall of forwell dish. If you don't have enough experience or good equipment and good objective of the microscope, they just disappear. It's possible. But actually, that if we provide some kind of image, live image or video, you will be sure at least about this. So you will start to search more about, and you will try to find your oocyte. Because even if oocyte fly and to stick around the wall of the, let's say, forwell dish or something, there is possibility to find. So biometric calculation will create a statistical algorithm, and we can have morphological oocyte efficiency for each individual cycle. So this is a very, very important, because as egg bank, we will be sure if we have from this donor high morphological efficiency. Not only clinical efficiency as a pregnancy fertilization rate, but morphological efficiency. Time-lapse mode can record live video for vitrification process and cryo-straw loading process. As I said, you can see directly on your straw, which is coming to your clinic. You can see that like how oocytes take a place over there. Information will receive from many different sources, but algorithmic calculation will be ready less than a minute. So this is very important, which you can be sure oocyte is not taking so long time outside. Recorded image and time-lapse video will be very helpful in case of low warming rate for the efficiency. Sometimes we receive efficiency report, we find out low fertilization rate, low survival rate. We are checking efficiency of donor, which we send to other clinics or supplier clinics, and we find out very high. So we are checking normospermia criteria in the clinic. It's difficult to find out why it happened. So this kind of system will give us at least like answer where we should focus on. This is what I am talking about, like difference between embryologist and artificial intelligence. If we are talking about around 400 average 30 oocytes, which embryologist grading and artificial intelligence grading almost a 10% different. So from every 100 oocytes, 10 oocytes, artificial intelligence saying no, but embryologist is saying yes. So how is the possibility of that this 10 oocytes will come to your clinic? Still there are possibilities. So that's why we are running as an egg bank even for 1%. So that's why for us very important to avoid all risks. Also, this is important, like what is the benefit of artificial intelligence on the clinical based? So from the same donors, like embryologist selection and artificial intelligence selection. If you find out euploid embryo rate, which is useful embryo for the embryo transfer, also 10% difference between embryologist and artificial intelligence. Even of course, between different embryologists, there are difference, but that is a normal because always, as we say, human factor will be included. But with artificial intelligence, we avoid many risks. So that's why result is much better. So I would like to say thank you. We are waiting your questions and we will try to give answer about this unique service, which you are wondering, any question.
Thank you so much, dear Birol. And we've got several questions already. I will start with the first one from Robert. And it is for the COVID-19 restrictions, and if we can tell if any restrictions in taking oocytes because of the COVID are present, does the person have to be vaccinated?
Yeah, sure. Firstly, let me explain as OVOGENE Egg Bank and laboratory staff as supplier clinic, all medical team vaccinated. So all of our egg donor before function, they have a COVID test. So without COVID test, we don't take any donor for the egg pickup. From the lab, as I said, we are using always mouse embryo assay tested disinfectant. We are using a very high quality HEPA filter system, always working. Still, we are using low wavelength of UV light during especially night, especially for cryo rooms. So we are trying to avoid all the risks. And of course, all staff have a periodic training according ESHRE and SRM guidelines for the COVID-19 restriction.
Yeah, thank you so much, Birol. And if the question, because it is not clear regarding which person should be vaccinated, if we are talking about patients, so it is not obligatory that patients should be vaccinated. It is very important that the patient is not sick in the period when we are going to perform embryo transfer. And it is recommended also, but this is for the decision of the patient and the clinician, to avoid vaccination in the period of the planned embryo transfer. However, there is no risks connected with the vaccination and the implantation or clinical pregnancies, etc. So it should be safe, and the person should be healthy. So, and another question, Birol, regarding the artificial intelligence from Natalie. Is the machine taking the different measurements for you, and then using the reference level you have determined to give a classification?
Yeah, exactly. It's working like this. So reference value, we are using actually how we built the system. So 100 normal morphological oocytes. So which we get a criteria for the publications. So from the 100, like high quality morphology oocyte, as we get a reference, we calculate an average of the diameter and we put as reference. So that system is calculating that all parameters according to these reference values.
Yeah, thank you so much. So these are still all questions for now, but I think that we may refer to the also individual patients which potentially can be joining us today, that as we have our partner clinics in almost all locations all over the globe, and in these complicated times of the COVID restrictions, we all know that it is very complicated to travel in order to receive the treatment. We are focused to be closer to you in your home city, in your home country. And you need just to contact us directly in order to find out who is our partner clinic in your location. And by visiting them, we will be happy to establish the, if there is no agreement yet, even the new agreement, or if this is already existing partner clinic. So you will be treated there with the highest quality donor oocytes and in your home city, in your home country, which is the most convenient right now. I'm checking if we have any other questions so far. Not yet. Just thank yous from both from Robert and Natalie. Thank you also for joining us and attending our webinar today. Birol, do you think we have something else to share with our attendants?
Yeah, actually, of course, I mean, just not our partner who is considering to work, just they can contact with us. We can send trial videos, trial image. Of course, they are always welcome to visit our lab. Our lab is open. So that one of the things as OVOGENE Egg Bank, what we are doing, so we are working totally transparent. So we can share everything, every ideas, even we can get their ideas, useful ideas, which they are thinking it will be helpful. If they are our partner, which they are thinking they have a difficulties, so they can just contact with us. As lab team, we have already 7-8 embryologists on the team, and all of us are ready to give fully support. Anyway, soon we will also start to make like a visit to their labs, not only online. So finally we get a vaccination, everything is much more clear. So we are available to travel. We will visit also their lab. We will try to share our experience. We will try to get from them their questions. But anyway, like we are, as you say, 24 hours for all of our customers all around the world. We are open totally for their questions.
Yes, thank you, Birol. Thank you so much.
Okay.
And this is true that we are acting as an international team, and we are looking into the globe, really globally, into the world globally. And we are here to help every clinic and every individual patient to be successfully pregnant, and to perform this as easy as possible and as flexible as possible. So if these are some restrictions and something is impossible, so we just need to think wider. And that's why we are here, and that's why we are meeting together with you, and that's why we are sharing all our experience. You know, that time is crucial in terms of getting pregnant for patients who are spending their times, and most of our patients, like we calculated the average age of our patients, and this is 43 years old. So these are those women who are not producing their oocytes already, and we know that they were trying many cycles before they went into the oocyte donation as their last option. However, this is the best option to get successfully pregnant. And once you're using a reliable partner as an egg bank, you may select the best donor, and we will take care about the best quality of the donor materials, and we will coordinate you through the whole process. So we also welcome you to watch all our previous webinars. They are all available online, and we are always available in order to answer any of your questions, coordinate the activities, and help you to realize your dreams into the presence. Thank you so much. Thank you, Birol, for joining us today. It's a pleasure, as usually, to hear your presentations and to get more aware about what you are doing as a laboratory team. As we always share with all our patients, that embryology is the core and the heart of the fertility treatments, and this is true. Definitely. So thank you everyone for joining, and we will see you very soon. Just follow our news and website, and we will be preparing very interesting topics. Thank you so much.
Thank you.